Azathioprine is an immunosuppressive medication used to treat autoimmune diseases as well as to prevent organ transplant rejection. In this video, I'll give you an easy way to remember everything you need to know about azathioprine on test day. Let's get started. Hey, over here! Deep in the heart of Mexico, my archaeologist friend and I just discovered some ancient AZTEC ruins. By the way, the word AZTEC kind of reminds me of the drug azathioprine. You know, since AZTEC sounds like azathioprine, right? When you see the drug name azathioprine either on test day or in clinical practice, bring yourself back to these AZTEC ruins. Let's get started by talking about what azathioprine is used for. I wouldn't touch anything quite yet. Oh no! By picking up the AZTEC shield, it's completely cracked. I'm sure back in the day, this shield was used as body protection, but in this weak, broken condition, it's not going to give much protection anymore. We use a shield to symbolize the immune system. You know, since the immune system's job is to protect the body like a shield against illness and infection. Well, in this case, the shield is broken and can't protect anyone. That's to remind you that azathioprine is an immunosuppressant, meaning it weakens or suppresses the immune system. This is useful in treating autoimmune diseases like lupus or Crohn's disease, in which the immune system mistakenly attacks the body it's supposed to protect. This can be treated by weakening the immune system with an immunosuppressant, like azathioprine. I do want to note that with a weakened immune system comes an increased risk for infection. So there's really two sides to this coin. Behind us on the wall of the AZTEC ruins is some sort of ancient mural depicting the removal of an animal's organs. Yeah, pretty gross, but it's definitely helpful in helping to remember that azathioprine can be used in the context of organ transplant to prevent transplant rejection. Since our immune system works to kill anything from outside our body, the same immune system can attack and damage transplanted organs from another person. This is where azathioprine comes in. This drug suppresses the immune system to prevent transplant rejection. Make sense? Okay, let's get to the side effects of this drug. In addition to the increased risk of infections that comes with suppressing the immune system, there's another major adverse effect we should mention. Seeing that these are ancient AZTEC ruins, it's not surprising to find empty, hollow bones scattering the floor. These bones have been here a really long time, so of course they're empty inside. By the way, these empty, broken bones are here to symbolize bone marrow suppression. Azathioprine reduces the activity of the bone marrow, whose purpose is to create blood cells. You see, cells in bone marrow are what produce red blood cells, white blood cells, and platelets. Suppressing the bone marrow therefore causes anemia due to less red blood cells, infections due to less white blood cells, and bleeding due to a reduction in platelets. Just remember these empty, broken bones to remember bone marrow suppression as a side effect of azathioprine. Alright, that's all for this video on azathioprine. Let's recap. Azathioprine is an immunosuppressant drug used to treat autoimmune diseases like lupus and irritable bowel syndrome, among others. Azathioprine is also used to prevent organ transplant rejection. A major side effect to know is bone marrow suppression, which can manifest as a reduction of red blood cells, white blood cells, and platelets. And now we're all done with this AZTEC archaeology dig and azathioprine. See you next time.
Thanks for watching. For more videos like this one, subscribe to our channel and check out our newest lessons. For more resources on this topic, including fact lists and interactive review images, click the image next to the More Here arrow. I'll see you next time.